This is an exciting topic for me. It's really subacute or chronic infection in chronic diseases, and I published quite a bit on this. Dr. Trump and myself in our Alzheimer's book and our Quarterback Your Own Health book, and then the short book called Uncovering Chronic Inflammation and Hidden Infections, which anybody can read. It's on our Health Revival Partners website under the menu tab books. So it's out there. But really, at the end of the day, 69,000 ICD-10 codes. I view mechanistically, there are four major mechanisms of all chronic diseases. Poor repair and recovery, so your wear and tear is outstripping your ability to repair and recover, so you slowly slip into this state of dis-ease. Sensitivities is number two. Thrive versus survive, which is really fight or flight. You're always, allocating resources away from repair and recovery because you're in this stressed mode. But the last one is chronic inflammation and chronic infection. And we all know Lyme disease, but there are many, many other pathologies, infections, mold, bacteria, virus, parasites that can contribute to just taking away a little of your repair and recovery bandwidth. So at the end of the day, it's all repair and recovery, but there are other mechanisms that will really divert that. So what we're going to do in this multiple part series is really cut to the chase on this. And then in the docu-series, I've talked about this in all my talks on Saturday, yesterday, and then I'll probably talk about it in context of cholesterol on Tuesday. So that's Jonathan Landsman, Natural Health 365. But really the person who really brought this to the forefront is not Paul Ewald, who's featured on this article in the Atlantic from 1999, but really it is Louis Pasteur and the germ theory dating back to the mid 1800s. Charles Mayo, the founder of the Mayo Clinic, talking about focal infection, really focused on bacterial pathogens from the mouth, that when you remove an infected tooth, all kinds of improvements occur in your health because these infections are not just in the mouth, they're systemic. And what are they doing? They're taking bandwidth away from your repair and recovery pathways. So anywhere else in your body that is susceptible can be deteriorating at an accelerated rate. But if you want a sort of a high-level overview of this topic, I recommend you look up this article in the Atlantic, and I have the link down there as well, Atlantic Magazine, but just look up the new germ theory. And this is from the evolutionary biologist Paul Ewald. He was at Amherst, now he's at Louisville. He says the new germ theory dictates, the dictates of evolution virtually demand that the causes of some of humanity's chronic and most baffling non-infectious, in quotes, illnesses will turn out to be pathogens. And once again, a pathogen can be any type of infectious process. Some of them might even be good at low levels, but when they get out of control, they can cause damage. So let's look at what Dr. Ewald says. This is a quote that I stole from him for the Alzheimer's book, chapter 9, how infection causes Alzheimer's. Some people think it's scary to have these time bombs in our bodies, but Ewald says it's also encouraging because if it's a disease organism, then there's probably something we can do about it. And he missed this by about, a century, unless Dr. Carter, myself, and other people in the forefront of this make some headway. But he says, well, in 10 years, he wrote this in 1999, I think the textbooks will have to be rewritten to say, throughout history, most people have died, and we means died young, of infectious disease. And most people continue to die young of infectious disease, even though we call them cancer, heart disease, Alzheimer's, and things of that nature. So if you want to go 2.0, there's Dr. Ewald, he's an evolutionary biologist. Get this book, Plague Time. And when you read it, send me the Cliff Notes because it's a complicated read. I read it a while ago and I started reading it again recently. And about a half hour in, my brain's exhausted and I fall asleep. But he doesn't mince words. He really gets into the nitty gritty of what chronic infection is all about and how it relates to disease. And so here's just some selected references from PubMed from Dr. Ewald: Evolution of Infectious Disease, Evolutionary Biology and the Treatment of Signs and Symptoms of Infectious Disease, Infectious Causes of Disease, so on and so forth. Vector-borne pathogens, which means vector-borne, it comes in through a mosquito, a tick, some other type of way. And then here's chlamydia, pneumoniae, and cardiovascular disease, an evolutionary perspective on infectious causation and antibiotic treatment. So is Ewald the only person talking about this? Absolutely not. Here's Gail Castle. She was the vice president for drug development at Eli Lilly. So she was a former vice president for scientific affairs and distinguished Lilly research scholar for infectious disease at Eli Lilly. And so here's a paper she published some time ago, Win at Lilly. And Lilly isn't doing anything about this, by the way. Infectious causes of chronic inflammatory diseases and cancer. She says powerful diagnostic technology plus the realization that organisms are otherwise unimpressive virulence. Extremely important 2 words, unimpressive virulence. You don't have the flu, you don't feel sick. You may not have any symptoms. Then suddenly you're diagnosed with Alzheimer's, or you're suddenly diagnosed with vascular disease, or you have a stroke or a heart attack, or you have reactive arthritis and no one knows why, okay? These are extremely important things. And the unimportant virulence is not just that you can't tell what's going on, but more importantly, your labs just go up slightly. I just got off a consult with a lady. Her white blood cell count were completely normal, around 5,000, just on the upper end of what I think is optimal. But her neutrophil to lymphocyte ratio, which we talked about in a previous talk on the chronic disease support program, was 5.1. Way out of whack. Her neutrophils were slightly elevated from what I think they should be, but the standard of care considered them completely normal. But her lymphocytes were extremely suppressed. And 30 years ago, 40 years ago, she had cervical cancer, HPV. So she's already preloaded with a burden of virus. And I believe that's what's going on with her today. She's completely convinced she has a cardiovascular problem going on, even though stress tests are good, but she knows when she walks uphill or walks for a long time, she gets out of breath very easily. She has some kind of infectious process going on. So it's interesting that Dr. Castle in her paper here talk about the infectious agents that we like to screen for on a regular basis. Helicobacter pylori creates gut dysbiosis, creates malabsorption, particularly of minerals involved in repair and recovery. Mycoplasmas, chlamydia pneumoniae, it's been associated with atherosclerosis. So this is a senior researcher, now she's at Harvard, doing third world work in infectious disease. So, very, very sophisticated, knowledgeable lady corroborating what we're doing. And I did a simple search for just an hour ago, chlamydia pneumoniae and vascular disease and cardiovascular disease, 4 million hits. The research community understands this, but the clinical community is really, really clueless. I've had many arguments with infectious disease doctors when I tell them that these low-grade infections are tied to disease. They just tell me you have no idea what you're talking about. And I usually return the favor.
Right. Yeah, exactly.
So what are vectors? They're small organisms that carry serious disease, so mosquitoes and ticks. And the kinds of things that they can carry, anaplasmosis, babesiosis, Bartonella. We don't test for all these things. Usually when you have one of the usual suspects on this list, you have others. So what we do is look for in our screening tool the usual suspects. And we try to keep it economical and bring some context to it. So for example, I charge a certain fee for a 1-hour consult. If you run my infectious screening, I charge the same amount as my 1-hour consult, and I give you a 1-hour consult. Why? Because these things are so underappreciated. I really want you to have access to this type of testing when you have unresolved or unappreciated or misunderstood or not understood chronic conditions, low grade, where you get brushed off by your doctor or whatnot. So, I'll give you a little story. Mrs. Rothschild, Edmund de Rothschild's wife, had macular disease. She came and saw Dr. Tremp twice a year at Harvard for her macular disease. And he tested her and he determined she had a type of rickettsial disease, an intracellular pathogen, most likely picked up through rat feces when she was in the tubes of London during the bombing of London, the Blitzkrieg. Okay, so these are the kinds of things that you can get exposed to, and you think chicken pox is the only thing that can go dormant and then reactivate as something fairly serious like shingles later in life. No, all these organisms are clever. They're trying to survive, so they can get into your body, hang out high, and wait for that opportunistic moment when you're vulnerable, and come out and play in a pathogenic or disease-causing way. So it's really, really important to understand. Just going to cover a couple organisms today, and then we'll break for questions and move on until next week. But Toxoplasma gondii. This is not me. This is from the CDC. Neglected parasitic infection. It's in the gut, but it can get intracellular. We worry about pregnant women being exposed to cat feces. Why? That's where Toxoplasma gondii can hang out. And it has a profound effect on brain development in the vulnerable fetus. Okay? But in people like you and me, it can affect the eye. You can see toxo scars in the eye, a little scar that shows the presence of Toxoplasma gondii can lead to blindness. You can have Toxoplasmosis, which is the disease from Toxoplasma gondii in the brain. And the number one disease associated with that, I don't think it's the number one disease, but it's the number one most published disease, is something like schizophrenia, brain or mood disorders. So depending on the state of mind of the CDC, they say 60 million Americans were exposed to it, but most don't have symptoms because they have healthy immunity. But can a mood disorder, a little brain fog, schizophrenia, is that tied back to low-grade Toxoplasma gondii? So it's very interesting, this pathway, and this was put forward by another evolutionary biologist out in Berkeley. It's in the 1950s, our military was thinking of infecting warfighters, soldiers, with Toxoplasma gondii. And the reason is it makes you somewhat fearless. So that's a good attribute for a warfighter, being fearless, not for the warfighter themselves, but for the military industrial complex. Then they found out that Toxoplasma gondii in the brain actually slows reactions. So a lot of people that have, rear end someone, a lot of them wind up having Toxoplasma gondii in their brain. So in this scenario, a cat poops out poop containing Toxoplasma gondii, the rat eats it, the rat is no longer fearful of the cat and actually goes to places where cats urinate, that's where cats hang out, only to be eaten by the cat, and the cycle perpetuates. But cat feces is not the only place you can pick up toxo. Let's call it toxo for short. Raw meat, every meat is, has some contamination in it. If you have strong gut acid, you might kill it. But most Americans, based on what I'm seeing, do not have strong gut acid. So the organism gets down into the gut, doesn't die, and then gets into your circulatory system. So these are the types of issues. So this is from Mayo Clinic, Toxoplasmosis, disease that results from infection with Toxoplasma gondii parasite, yet it's a microparasite. It can get inside cells. That's how small it is. It's one of the world's most common parasite. Infection usually occurs by eating undercooked contaminated meat, exposure from infected cat feces, or mother to child transmission during pregnancy. So we like to think these are genetic disorders like type 1 diabetes and any number of other conditions we tie back to genetics. But unless you have Down syndrome or cystic fibrosis or sickle cell anemia, these are genetic disorders. A lot of things that have been written off to genomic diseases are really infectious. And if you hang with me for part 2, I'll explain how these organisms affect your genome. So here's a couple articles: Toxoplasmosis and psychiatric and neurological disorders. Toxoplasmosis has been linked to many behavioral disorders. It's a gastrointestinal pathogen. Once again, it shouldn't be. If you have really strong acid, it probably won't survive. Brain parasite directly alters brain chemistry. Toxoplasma infection may trigger neurodegenerative diseases. So in this case, it might actually be a really neurodegenerative disruptor. Oftentimes, I believe these infections affect the vasculature, which then affect the brain. But in this case, I believe it probably affects the neurological tissue. It's very fat soluble. So this is the program I offer, chronic infectious screening and consultation. I threw this up here. This isn't the complete list of tests we do in this. I just chopped it off. But the reason why I brought this up is these organisms affect cellular health in a number of different ways, and I'll go over it in more detail next time. But this is an electron micrograph of a dead cell. And these little green dots look exactly like mitochondria. But they actually, in this case, are chlamydia or chlamydia pneumoniae, depending on what microbiologist is classifying it. But the interesting thing about these organisms, when you look at mitochondria, it evolved from a symbiosis between bacteria and the cellular structure. So at one point, mitochondria was a DNA assembly that was not of our own. But today, the mitochondria is part of our own DNA makeup. These organisms, like chlamydia pneumoniae, are called obligate intracellular pathogens. What does obligate mean? They're obliged to the host for energy. So whereas a mitochondria supplies you cellular energy, an obligate pathogen takes energy away from you. So it's, why are you tired? Chlamydia pneumoniae. One bit of energy for you, one for me. One for you, two for me. As you can see, with complete overrunning of the intracellular milieu of this cell. And the other thing they do, because they don't want to go extracellular, so intracellular means inside the cell, they don't want to go extracellular outside the cell if they can help it, because your immune system can then see them, can't see them in here, is they will make a cell cripple along way past its programmed cell life. That would be Robert Horvitz at MIT, who won the Nobel Prize for apoptosis, programmed cell death. So these organisms can actually change the DNA of your cell so its programmed cell death does not occur on the time frame that is normally expected for that cell. So here's Professor Thomas Barote, head of the Center for Digestive Diseases. He is big on fecal transplants, but I have a couple little audio files from him when we interviewed him recently, a couple of years ago. But he's going to talk about chlamydia pneumoniae. Hopefully you can hear it. If not, I'll make sure that on the audio file, when we put the video on the YouTube channel, you'll be able to hear it. But let's listen to Dr. Barote. Oops, we got to hit the play button.
I treat patients with inflammatory bowel disease, right? Yes, sir. And so we push their levels up to very high levels for the following reason. If you have enough high levels of vitamin D, your white cells, your immune system starts working. Because the white cells, the macrophages, which carry the infective agents, such as mycobacteria, such as chlamydia pneumoniae,
I'm stopping it for a second because what he's saying, and this is how insidious these organisms are. They travel throughout your circulatory system within your immune system. They travel within inside a neutrophil. And why is vitamin D important? Vitamin D as a prohormone, not a vitamin, makes your neutrophils work better. So that's why when you have high levels of vitamin D, you're protected from COVID, and you're protected from other chronic diseases, because rather than being a shuttle bus for pathogens around your body, that shuttle bus is really a trap.
The coronary heart disease, they will kill the intracellular pathogens, bacteria, if your vitamin D is very high. If it's very low, the bugs live inside and spreads. So you need to have your white cells work. Otherwise, with low vitamin D, you're not able to fight chronic infections. Now you might say, well, then what chronic infections are you talking about? Well, up to 40 different infective agents live inside our macrophages, white cells. Tuberculosis among them, the Crohn's bug, the chlamydia trachomatis, the chlamydia pneumoniae, even BCG. You know how we used to be immunized in the 60s? Yes, sir. Bacillus calmette-Guerin, developed parrot bacterium. It didn't do a lot to help. But, I mean, I'm infected with it. It sits in my macrophages. Someone detected it for me in New Zealand who studies these things and cultures white cells. So there's a lot of information. I'm just giving you a little tip of the iceberg. Yeah. It's a fascinating area. I treat patients.
Oops, sorry. Let's do video or audio file 2 from Dr. Barote, one of the most distinguished guys I've ever had the pleasure of talking to.
You got high chlamydia antibodies, right? Yeah, right. Well, what's chlamydia infect? Your coronary arteries. Oh, we don't want that. Well, that's where it's living, like it or not. 80% of men over 40 have got chlamydia infection of arteries. How do you get rid of that? You can't. Yeah. You can, but it's very difficult. I've got a trial running here, 14 patients enrolled. I took it for 3 years. You get rid of it with rifabutin, clarithromycin, and doxycycline. But it's a big deal, requires 2 hours of explanation, lots of paperwork. Yeah, it's not worth it. No. I took it. My brother died, father died, mother died of it. And you still got your high chlamydia? No, I don't. But I took the fucking antibiotics for 3 years because my heart's very important to me.
I think that's a very important statement that Dr. Barote said. I treated it. I'll just translate it. I treated the chlamydia pneumoniae because my heart's important to me. I mean, that says it all, really. Just some other things on chlamydia pneumoniae. Is a trigger for triggering infection and reactive arthritis. Tons of papers on this. Chlamydia pneumoniae was a triggering agent in 7% of patients with reactive arthritis, or UA, undefined arthritis. In this study, it was the only triggering infection in 10% of patients with reactive arthritis. The thing is, though, a lot of people don't understand how to test it. Okay, so they're looking for IgM, which is sort of the quasi-acute phase of it. But really, I believe the number is much higher than they're presenting here, because you got to look at the IgG, the so-called historic form of chlamydia pneumoniae, but it really is the intracellular form of the agent, the stealth form of the agent. And Charles Stratton, I'll have some data from him next time, at Vanderbilt, has studied this organism more than anybody in the world and shows that it exists in 3 phases. One of those phases, I think it's the elementary body, is refractory to antibiotics and your immune system. So in other words, you don't even see it, even though it's there. So a very important thing. Infections preceding early arthritis, big study. Of all the patients, 45% had evidence of a recent infection preceding the arthritis, as indicated by laboratory tests and or disease history. But they're looking at recent infection. They're not looking at crypticity, which is a concept that Dr. Ewald talks about in his book. Crypticity is very simple, cryptic. Potentially unrelated, or you can't create the association. So myself, I had AFib. I had a perfect storm of poor repair and recovery when I was like 40 years old. I had Lyme disease, going through a lot of stress, and had a little flu bug or something. And so I wound up with AFib. But I tested positive for Lyme disease, even though the tests are horrible. And one of my best friends, cardiologist, said, nah, nothing to do with AFib. He's completely wrong. I still love you, Craig. Don't worry about it. But the point is, I hadn't been bitten by a tick in 20 years. That's crypticity. Bitten 20 years ago, having something popped up associated with it 20 years later. So no one's connecting the dots, really. So chlamydia pneumonia is a triggering infection for pain. It's a triggering factor in approximately 10% of patients, but I think it's more than that. So what else do we have? Cardiovascular disease and chlamydia pneumoniae. Huge number of studies on this. So they show strong associations existing between chlamydia pneumonia infection and atherosclerosis. Seroepidemiological studies have associated C. pneumoniae antibodies with cardiovascular disease. And the biggie, more in cardiovascular disease, look, even in young adults, coronary artery disease in young adults, 15 to 34. This is Grayston out of University of Washington, professor emeritus. He's 96 years old, and he's written more about this organism and how you treat it than anybody. He tried to train doctors on understanding the chronic phase versus the acute phase, quote unquote, unsuccessfully, because he was trying to train traditional allopathic doctors. Chlamydia pneumoniae, J. Thomas Grayston again. Chlamydia pneumoniae is not new, and it's related to cardiovascular disease. Alzheimer's, Brian Balin. He took deceased Alzheimer's sufferer brains, looked at the plaques, and looked for chlamydia pneumoniae. And he's been publishing, this was his original paper, and he said that he finds indirect evidence that suggests the organism is there. But now, I know Brian pretty well. 20 years later, there's no question about that association. So we assess the presence of chlamydia pneumoniae, and that's found. Balin's work is beyond reproach. He's at the Osteopathic Institute of Philadelphia. More on Alzheimer's, and chlamydia pneumonia infection is associated with late onset Alzheimer's. I'm just taking this from Scholar Google, so they're just references for your edification. Late onset Alzheimer's and chlamydia pneumoniae, very strong correlation. And if you really want to understand this, a little self-serving, but I have 4 videos. They're each about 6 minutes from number 1, 2, 3, and 4, and showing you the connection between heart disease and Alzheimer's disease, and how chlamydia pneumoniae plays into this whole cascade. So let's see. Yep, 2 more slides on this. This is New England Journal of Medicine. Pretty good pretty good journal. Like I said, if you published in Lancet, it's because the New England Journal rejected you. It's the #1 journal. Proteotoxicity and cardiac dysfunction, Alzheimer's disease of the heart, ? Okay. Defective disposal of misfolded proteins is involved in the pathogenesis, the cause of neurodegenerative diseases, cystic fibrosis, and heart failure. Experimental studies suggest that therapies that target misfolded proteins may have broad clinical application. They're completely wrong there, but I'll explain. Proteotoxicity, protein toxicity, they're wrong here too, but at least they're presenting the concept that very few people are discussing, are plaques, misfolded protein or unfolded protein. So what they're saying in this article is the same plaques found in the brain are found in the heart. Okay, and let's dissect this with one last slide. And this is from Harvard. This is Dr. Tansey. He kind of gets it. He's somewhat controversial at Harvard. He's the Rosef and Joseph P. Kennedy Chaired Professor of Neurology at Harvard. Who's higher than that in the neurology world? He's a PhD, but he's done some very good work. And Robert Moyer was someone I met and had some great conversations with. Unfortunately, he died of a glioblastoma like 2 years ago. But what he shows is that this quote unquote therapeutic target of the plaque is really not a target. It's an antimicrobial peptide. Now, hopefully this brings the whole piece together for you. Vascular disease and chlamydia pneumoniae, brain disease and chlamydia pneumoniae, plaques. Plaques are part of the innate immune response. And the Alzheimer's plaque is not a clinical target. That's why every major pharmaceutical company spent 25 years trying to develop a anti-plaque drug failed because they were actually making you worse. They were treating what your innate immune system was doing to protect your heart or to protect your brain. So the amyloid protein is believed to be a key mediator of Alzheimer's disease pathology. In other words, causal agent. AB is most often characterized as an incidental catabolic byproduct. However, A beta, or the amyloid, has been shown to be a specific ligand for a number of different receptors and other molecules transported by complex trafficking pathways. But at the end of the day is what they showed in this study is that so-called evil is actually your body fighting infection locally, focally, in the brain, in the heart, cataract, unfolded protein response, antimicrobial peptide, in the eye. It's a sign of something underlying inflammatory and infectious. And with that, we'll go to the question board and see what we got. Sleep is as important as diet and exercise, no question. Is there an issue with electromagnetic fields with Fitbit? Any comment, Michael?
Not that I know of. But I mean, electromagnetic fields, I mean, again, if you're sensitive to it, yeah, it's going to, not be very, very beneficial for overall health. So, but everyone is not the same with that. There are some that are exquisitely sensitive to EMFs. But yeah, with the Fitbit, no, I can't see why that would cause any interference.
Yeah, from Maura, she said, you were fortunate ablation works. Many have no luck with it. Dr. Kerner and I have a colleague that's a former running back in football. And he's had 6 ablations, and now he's going to get a pacemaker. And we begged him to do testing with us, and he's like a football player, football player mentality, won't do it. But if you don't get rid of the cause underlying why your electrical system is being diverted, and it's always vascular first, neurological second. So there's some pathology in the heart affecting the electrical conductivity between the upper and lower chamber. And you can skirt around it with an ablation, but then it's still there and it'll affect that. And you just, you keep going back into AFib every 2 to 5 years, like this gentleman. So it's a
and the other thing is, going back to the magnesium, again, because ultimately, from a nutrient standpoint, magnesium is critical, in the rhythm of the heart, but also when calcium deposition comes in, and that can disrupt the electrical signal. Magnesium also plays a critical role to clear the vessels and the microvasculature of the calcium. Now, it takes a while, a year, 2 years, 3 years, and so forth. So it's not a quick thing. But again, at the end of the day, optimizing your nutrient levels, especially magnesium, vitamin K2, things of that nature, can play a significant role in the genesis of AFib as well.
So Sonia says, I read Plague Time based on Dr. Lewis's advice. I found it to be a great read. That's obviously a woman who has a really good brain. And once again, Sonia, I'm requesting the Cliff Notes. Anyway, thanks for reading it. Jim, he's always on the cutting edge too. Is there a U-curve for the neutrophil to lymphocyte ratio? What is the max, the min, and the indications on either side? Jim, I don't think I've studied the low end, but usually when your neutrophils are low because your lymphocytes are up.
It's an overwhelming bacterial infection. So the low end it's chronic infection.
So I need to upgrade my algorithm on that. I just haven't studied on the low end, and Dr. Carter is absolutely right. Reactive arthritis, thank you. Thought it was autoimmune, idiopathic. And when you look at autoimmunity, so often it's a guess. It's, molecular mimicry from leaky gut, from particles that, aren't properly digested, your immune system attacks. But oftentimes it's stealth infection that's not being looked for either, or both. Periodontal disease will cause autoimmune disease.
Absolutely.
Thanks for the recommendation. Plague Time. Yep. Cliff Notes, please. Since toxo is a parasitic disease, is ivermectin effective against it? I don't think so. It's intracellular. Dr. Carter, if someone has toxo, they really need to, see Dr. Carter, because he has there's really, in the standard of care and even in functional medicine, the treatments that are used are really for acute phase toxo, but it's the chronic phase that causes the problem. So Dr. Carter, you want to comment on, what you would do in that case?
When the infections become intracellular, they hide from a whole host of, traditional medications and so forth. And it's a long-term process. So, I use a combination of things, but again, you also have to look at the role of other hurdles in the way, such as parasitic infections. And everyone carries around parasites, everybody, bar none. You don't have to travel internationally to get parasites. There are plenty here. But and some of them are actually commensal, and friendly, shall we say. But when you have a preponderance of those that are causing problems, and then you combine that with, the dysbiosis and the viral infections and heavy metals and mold toxins, then it becomes, you have to kind of peel the layers of the onion back. But yes, toxoplasmosis can ultimately be reined in, just like Lyme disease, but it is kind of a journey. So I use several different regimens to accomplish that.
Jim says, is there a screening that covers all vectors, one lab panel that covers everything for toxoplasmosis, or there are blood cell indications that make you suspect? That's because they're so insidious, and sometimes your white blood cell counts aren't even up by much. We test in our screening for Toxoplasma gondii, IgG. None of them are perfect tests. And the other thing is, there are groups. We met J. Craig Venter, who, did the genome of the ocean. Now he's doing the human genome. But there's companies like Eperiomics and Fry Labs. I've had people, and one of them's on the call today, that have sent their blood to Eperiomics. That's supposed to be able to really do the PCR testing or genomic testing on these organisms, they come back negative. I'm wondering what their true sensitivity is. So, you know, the best thing we can do is do the blood panels that we're doing right now. And we offer a couple different blood panels, a screening and then a deeper dive. You know, I'll give you an example. I do chlamydial antibodies. And so it's looking at 3 different types of chlamydials. And when it comes back negative, LabCorp dictates that. And they don't tell you what the absolute number is. They just say, oh, it's below this threshold. But what I've shown is when I run the specific chlamydia pneumoniae, IgG and IgM, and the chlamydial antibodies are just barely elevated, then usually the chlamydia pneumoniae itself is very highly elevated. So I'm now suspicious that if I just run the antibodies, it's truly a screening tool, but it's not necessarily you don't have it. If it's positive, you have it. I'm convinced of that. But when it's negative, it just means your levels, you may not have it or your levels are clinically irrelevant, but not necessarily. So I will actually be publishing that now because I have a lot more data thanks to folks like you that are listening and, you know, are concerned about ill-defined conditions. So I really appreciate that, that question, Jim, and we can discuss that. Bragg's apple cider vinegar before every meal benefit, need for more as one gets older. I mean, you know, at the end of the day, your stomach acid is way stronger than the apple cider vinegar acid. So you're getting good organisms, but ultimately you need to have an environment that produces strong acid.
Right.
You know, and I had, you know, Jonathan Wright has a co-patient, you know, he had him years ago, has him on betaine hydrochloride and digestive enzymes. But if he stops that, he goes back into reflux. Jonathan Wright, the guru on stomach acid, didn't solve the problem. He was symptomatically treating it. So the number one thing to look for is Helicobacter pylori at any level, because at any level, it's breathing ammonia. It's breathing an antacid in your gut. So you've got to get rid of it. You got to get it down to the lowest level you can get if you truly want optimal stomach acid and the good diet and all the other things. Michael, I get to give you a couple minutes on that one if you want, but I'm running out of time.
No, that's perfect. Yeah.
Oh my goodness.
And the other thing is, you know, if you are in fact positive for H. pylori, you know, and when people do a deeper dive test with me, they're also what are known as virulence factors. So let's say if you did our screening test and it came back pretty high, then the ideal thing to do would be to do a GI map. And if there are virulence factors there, you definitely want to be more aggressive, because if you have those, that increases your risk for gastric cancers, you know, and ulcers and all of that.
You know, vitamin D, several people ask that, you want to be up to at least 55 nanograms per milliliter, somewhere between 55 and 85, I think is ideal. I have a lot of data on that from a variety of different sources, including Michael Hollick, who's a guru, someone I met, and we had a long chat. Jim asked, how did Dr. Barote treat his C. pneumoniae? We're not going to talk treatment on these seminars, just not going to do it, Jim, but you can call me. I can make it available to you how he did it. But just so you know, he's the one who developed the triple antibiotic for H. pylori. He was on the Nobel Prize team, 2005. He wasn't an awardee. That was Warren and Marshall. He was an understudy at the time, but he developed that. So he's more leaning in that direction, but he's also a gastroenterologist, I believe one of the best in the world. So there are ways to do this, but I wouldn't suggest that antibiotics is the first line of defense. And I lost my chat. I think we're just going to do one more question. You know, come back next week for part 2, and we'll answer these questions. Is the misfolded protein tie into pyroluria? I don't know what that is. Do you know what pyroluria is, Michael? PYR.
Totally different. Yeah, that's that pyroluria has to do with generally nutrient deficiencies, like some of the B vitamins and some of those. But yeah, that totally different.
Yeah, someone asked about the treatment. Is it specific or general? You know, pre-treating your immune system so it's perfect and ready and resilient for whatever next phase treatment you do is generic. Organisms have specific treatment pathways or particular things. I think that's all we can take for today. I'll do my best to, let's see if I can save chat, and next time we'll do that. It says saved. Lord knows where it went, because I've never done that before, but I'll look for it. But bring your questions back next time, because we're going to go into more on this topic. And we, of course, will be talking about this again 8 p.m. tonight. Consider listening to, tomorrow night, sorry, Tuesday night. Thank you, Michael. And consider signing up for the free seminar, the cardiovascular docu-series with Jonathan Landsman, Natural Health 365. Somewhere on his site, you'll find that. Or go to my blog. I give a link through me to register for that. So very good. We'll see you next time. Thank you so much.